Our next presentation is from Dr. Neil Orr, who is a Senior Research Fellow at Macquarie University at the Department of Linguistics, and he's also involved with the Poche Centre for Indigenous Health here at Sydney. He'll be co-presenting with Sam and Harkness, and she's a research partnership and strategy lead with the Aboriginal and Torres Strait Islander Health at the National Acoustics Laboratories. Their current research focuses on Aboriginal and Torres Strait Islander ear and hearing health and oral health and the scaling up of healthcare programs. So today, Neil and Sam will be presenting on the findings of a rapid evidence review on ear and hearing checks for Aboriginal and Torres Strait Islander children. So over to you. I think, Neil, you're taking the lead on this.
I am, yeah. Thanks, Tom, and thanks, everybody. It's lovely to see everybody around back at Poche. My name's Neil Orr, and the title of our talk, is Ear Health and Hearing Check Project. And the aim of this project is to develop guidance for ear and hearing checks in primary health care for Aboriginal and Torres Strait Islander children. I'd like to acknowledge the large group that's involved in this project, which has been ably managed by Sam, who's leading the project. And as you can see, we're from a range of universities and agencies, from the Poche Centre to National Acoustic Laboratories, Royal College of Australian General Practitioners, Hearing Australia, University of Newcastle, and we've also have somebody from the University of Sydney Library. Now, I'd like to acknowledge and pay our respects to the traditional custodians of the lands in which we meet, on Gadigal land here in Sydney, and also I'd like to pay our respects to elders past, present, and emerging. And to introduce the subject, I'd like to hand over to Sam. So, thank you.
Thank you, Neil. And can I reiterate, it is great to see you all sitting at the centre today. And I just want to say it's been a fantastic experience working with the Poche Centre on this project. So thank you for your support with this as well. So I'm just going to do a bit of scene setting. So yes, my name is Sam Harkness. I'm an audiologist. I'm non-Indigenous. Worked for quite a long time in providing services to urban, regional and remote Aboriginal and Torres Strait Islander communities in hearing rehab. And I've recently moved across to our research arm, the National Acoustic Laboratories. Okay, so this project is really focused on one small part of a pathway that is not working very well and hasn't worked very well for a long time. And the small part that it's focused on is on the act of checking children's Aboriginal and Torres Strait Islander, young Aboriginal and Torres Strait Islander children's ear health and getting an idea of how well they're hearing in primary health settings. One of the really tricky things about otitis media or middle ear infections for young Aboriginal and Torres Strait Islander children is that there aren't many signs and symptoms, so it can actually be quite tricky to pick up in primary health. And of course, primary health are really key in this activity. We know that that ear infection can start from the first few weeks to first months of life. So children pass newborn hearing screening, but it isn't very long before they develop an ear infection. And if that's chronic and so persists for a long time, it can cause hearing loss that can have an impact on their development and on their lives. So routine checks are a key activity, whether there are any signs or symptoms or not. And our fantastic otitis media guidelines for Aboriginal and Torres Strait Islander children encourage checks at every clinic visit for young Aboriginal and Torres Strait Islander kids. But we know from a variety of published and peer-reviewed sources that they actually are rarely routine. The other thing is that what actually is an ear check. So defining what the components of an effective ear check are for this condition, for this population, young Aboriginal and Torres Strait Islander kids, also needs some work. So the aim of this very collaborative national activity is to develop some recommendations by the end of February, we hope, next year, that are evidence-based and feasible for primary health settings, that describe the components of ear health and hearing checks for young Aboriginal children, from early after birth to up until the age of 6 years, in primary health settings, and also look at a set of ages at which they should be carried out, so a schedule in effect. And we think that should complement the message of every visit, checking ears at every visit. The project as a whole is laid out in the little flow diagram on the right, and it starts with, of course, defining the problem and what the research questions are, and setting up a working group to provide oversight of the project. And so a working group has been accompanying us on this journey, half of whom are Aboriginal or Torres Strait Islander, very strong primary health representation. And we meet with them periodically in the process to check in and get advice on direction. So Neil is going to talk about the rapid evidence review, and I'll check back in with you later.
Thank you, Stan. That's great. So as part of the project, we conducted a rapid evidence review. And this was really to find out what the evidence was around the efficacy of tools for screening for otitis media, and also for hearing and listening, for screening for those things, and also what the components of an ear check. And these are the questions that we use to define the review. So looking at screening for otitis middle ear status, including sensitivity and specificity, screening for hearing and listening, including sensitivity and specificity, and the tools around that. What are the recommended components for hearing checks? What the literature says about that? What are the key ages for hearing and ear checks? And what are the feasibility requirements for implementing the hearing checks? The rapid evidence review really looked at questions 1 to 4, and question 5, which is around the feasibility, is becoming another project as we look at the complexities of implementing our recommendations. So we did a literature search. For the literature, we looked at 2 lots of literature. One was around the literature in the literature search, and the second was looking at a guidelines review. For the literature search, we were assisted by a librarian. The period that we covered was 2000 to 2021. We're looking at English language literature only, and we used a range of databases, and we reviewed using the confidence reviewing software, which allows you to kind of integrate and synthesize evidence and to conduct reviewing efficiently. And the search terms were based on otitis media, what you know about otitis media, hearing loss, Aboriginal Torres Strait Islander health, children, and also primary health care. For the clinical practice guidelines, we had no period, no limit. We were looking at English language or translated guidelines, there's a few of those. We were looking at screening, diagnosis, and management of otitis media. And we looked at the guidelines which were both from Australia and international. And also, if they were related to Indigenous populations, they were of a special interest. Now our results, we found 4,620 papers in the review. Of those, we reviewed 2,478, and we found that 22 were in scope for the literature review. And of those, 12 related to otitis media, 10 to hearing loss, and 5 of those papers related to Indigenous populations and were included or were Indigenous studies. And we also looked at 11 guidelines. So our findings were that we found that the evidence around screening fell into 4 domains. There was screening, which was around parent and carer reported concerns around the signs and symptoms of otitis media or listening. And this also related to things like the child hearing and talking, their balance, whether they had hearing and ear infections. And this was really apparent coming to a primary healthcare centre with these concerns. And the workforce involved in this kind of screening were GPs, nurses, and Aboriginal health workers. For ear health, we found evidence around simple otoscopy, video otoscopy, pneumatic otoscopy, and tympanometry. With regard to otoscopy, with regard to ear health, pneumatic otoscopy and tympanometry are known to be the gold standard ways of screening for otitis media. The workforce for this was GPs, nurses, Aboriginal health workers, which depended on the type of otoscopy, and there was additional training needed for pneumatic otoscopy and tympanometry. For hearing sensitivity, we found there was evidence around otoacoustic emission testing for 3 years and under, automated hearing screening applications such as sound scans for 4 years and older, manual screening audiometry for 4 years and older, and also there was some evidence around a whispered voice test. And the workforce that could do this kind of screening were GPs, nurses, primary health care, and community workers. And in addition, there was screening for listening and communication skills. And this was primary parent report, and this related to parent questionnaires. And there were been 2 developed by National Acoustic Laboratories and Hearing Australia. They're called the Plum and the Hats. And they are for kids who are 6 years and under. And the workforce for this screening were GPs, nurses, primary health care, and community workers, and there was no training required to conduct these questionnaires. With regard to the intervals in timing, there was very little consensus on the timing of hearing checks. Some guidelines reported that ears should be checked at every opportunity. Sometimes it was annually, sometimes it was every 3 to 6 monthly, or it was at other preventive health events such as immunisations. Okay. So we'll just move back to Sam.
Hi, thank you, Neil. So what we're doing at the moment is grading the quality of the evidence that we found from each of those publications, and we're preparing to move into a consultation phase, so a Delphi process. We have around about 60 key experts from around the country to take part in that process to help us finalise the recommendations. And so we're hoping to bring that to a conclusion in February next year. But we're also really aware that having gone through I think quite a solid process around developing the recommendations, so many evidence-based recommendations that are developed don't necessarily get taken up into practice unless there's a considered process around implementation. So that's what we're doing at the moment. We're preparing to submit for funding to look at how these checks could be implemented into practice so that they lead to sustainable change in practice, such that young Aboriginal kids' ears are checked at using effective checks at key intervals in their lives. particularly in the very early years. So that's where we're at. It's been a really fantastic process. Great team. So, Neil, shall I say thank you for listening?
Yeah, thank you for listening. Yeah, thank you.
Thank you for listening.
Or in the chat line, which will hit a few chats there.
Yes, I'm just checking with the offline interpreter. No, we don't have any questions from the audience.
No audience questions, but I've got one, and it's prompted by seeing Michelle Kennedy's name as one of your collaborators. And Michelle's been a presenter at previous showcases with us, but her interest has been around smoking. And I noticed that, I know that you're doing the literature review and so forth, but there's no engagement with parents or no indication of parental involvement in say, a population health education approach to addressing otitis media, and particularly with smoking parents and that secondhand exposure of tobacco smoke on kids. Did that come up at all, or is that what Michelle's role is going to be?
It didn't come up in this project because this is really just focused on the act of checking children's ears in primary health settings. Yeah. And there are so many other things that, you know, that need to happen in order to really make a difference in this space. So this is just focusing on one tiny step. But no, Michelle has been really helpful in advising around methodologies and ethical processes in this project. And I think that they are, she is kind of doing a little bit more in the ear space. She was super involved in one of our recent Plum and Hats projects. But we'd love to see her in this space, but I know she's super busy in her usual, you know, fields of work.